Joint Commission Taiwan, Taiwan biggest accreditation program, and Dr. Sutoto, Chief Executive from KARS, also Dr. Pandu Riono from RSM FKUI, endocrinologist. We are going to start our international webinar with Taiwan to learn about how good Taiwan has control or cope with COVID-19. For the first agenda, we would like Dr. Sutoto to open the meeting. Thank you.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Indonesian Commission on Accreditation of Hospital, KARS, together with Indonesian Hospital Association, Intervensi, held a webinar discussion on the topic lesson learned from Taiwan's experience with COVID-19. Taiwan experience with SARS in 2003 helped to encourage the government to react immediately to the emergence of the new infectious diseases that came to be known as COVID-19. Initial intervention, flexible common structure, integrated big data, and proactive disclosure of information made it possible for Taiwan, that is situated only 130 kilometers away from China and has a very high
Suaranya kurang bagus, Pak. HP-nya nyala ya?
Enggak.
Enggak.
But amazingly, only recorded a few positive confirmed case COVID-19. There are a number of lessons to be learned from the effective response of the government of the Taiwan to COVID-19, which must be shared with other parts of the world to combat the ongoing pandemic, including us, Indonesia. Thank you to my best friend, Professor Pa Chung Wang, medical doctor, MSc, MBA, Chief Executive Officer from Joint Commission of Taiwan, GCT, and also to Dr. Kadar Marika from Malaysian Society for Quality in Healthcare, also to Dr. Pandu Riono, MPH, PhD from University of Indonesia, to be able to contribute to this webinar. I hope that God will put all this good deed to humanity in a good record and bless all the speaker and us with good health and prosperity. Amen.
Thank you.
I'm sorry. Next, we are going to show two videos how the world acknowledge the supremacy of Taiwan in COVID. Please, your time, Prof.
Okay.
Yes.
Yeah. So may I start now? Okay. So good afternoon, everyone. Can you hear me well?
Yes.
Okay. So it's my pleasure and my honor to discuss with you, to share our experience in Taiwan during this COVID-19 pandemic. In a few days, our President Tsai will inaugurate her second term on May 20th. So I'd like to thank to our government and the leadership from our commanding center to help the Taiwanese people to get through all this ordeal. So below in my presentation, I will go over our experience during these past few months. I will explain more about what have been shown in the video. Next, please. Next slide, please. Okay. So yeah, as mentioned by Dr. Sutoto, Taiwan learned a bitter experience from SARS during 2003. During the SARS pandemic, Taiwan had 300 cases and had 47 deaths, including 11 healthcare workers. So that was a very painful experience of us. So we've been very, very careful about all the pandemic during these past 17 years. So not only happened this year, during the past more than 10 years, you know, we rehearse again, and we prepare the day. For example, during the pandemic of H7N9 and also the MERS, we initiate some disaster mode, but that's only a very small scale. So that means we practice again, you know, for this kind of massive outbreak. So during the SARS outbreak, we learned something. First of all, we learned that we need to secure our hospital, because during the SARS outbreak, several hospitals has to shut down because their service were crashed by a huge amount of the patients. The National Taiwan University Hospital Emergency Service, they had to close. That never happened in its more than 100 years history. So first of all, we know we need to protect our hospital. We need to protect our healthcare workers. So we need to control all the outsourced hospital workers, because in the big Taipei Municipal Hospital, the outbreak started from the laundry workers. They outsourced that laundry service to a company. So the worker brought the virus back into the hospital. So after that, you know, we imposed a very strict law, asked the hospital to control their contractors for the meal service and for the laundry service. And although we learned that we need to secure the resource supply, as you have watched the video saying about the mask, the government responds very quickly, because they know there will be some shortage of the mask problem. And although a very important thing that I mentioned in the video is that you need to control the fake news. First of all, Taiwan's government and hospitals' websites are constantly under attack of the international web hackers, including many from China and also domestic. And the people will spread the fake news that will cause a panic in the society. So government want to control the fake news. The way they respond to it is to make all the information transparent. Next slide, please. Okay, so how it started. The first case happened in Wuhan at end of December. Right now, I know that there have been controversial debate about who is the number 0 patient in many countries and in the world. But Taiwan CDC first noticed that several cases in Wuhan were quarantined by the very strange atypical pneumonia. So they get alerted. They know they have to respond. So they report to WHO. So that's a major debate point, whether Taiwan has transmitted this important information to WHO and asked the WHO to tell the world that there is something happened unusual in Wuhan. And Taiwan's first case arrived January 21st. So that's the first case of Taiwan in January 21st. So as you can see from the slide, it is said the first case in China come from Wuhan's seafood market, and it is also debated that whether this first case is related to the P4 laboratory in Wuhan, because the laboratory is not far away from the seafood market, only from the walking distance. And not long ago, about 1 year ago, in other province, the director of another P4 laboratory was verdict because he sold the lab animals to the market. So we are very suspicious whether this is a man-made virus or where is the true origin of the infection. And everybody has to understand the Wuhan. Wuhan is located in the center of China. It's pretty much like the Chicago to United States. It's a major manufacturing center, and also the communication and the transportation center, because the major river, Yangtze River, flowed through Wuhan, and the road connection and although the water connection of Wuhan is very convenient, and it is also very easy for all the passengers to bring out the infection out of Wuhan, especially at the beginning of the Chinese Lunar New Year. About 5 million people fled from Wuhan before the lockdown. They need to go home for the Chinese New Year vacation. But at the time, they also brought out all the virus to whole China and even to the world. Next slide, please. Okay, so what are the major strategies of Taiwan? I will mention that in greater details in my later slides. But first of all, it's to block the entry of all the suspicious cases from entering the border of Taiwan. It's easier for Taiwan because Taiwan is an island. So when you block the airport, when you block the seaport, it's easier than other countries to prevent the imported cases from outside. Then content, because inevitably, you will have some small scale community spread. When the people coming back from China or from other countries, they will bring back the virus. And at the beginning, because they are asymptomatic, so we don't do the full-scale screening for all cases. So inevitably, you will have some small scale of community outbreak. So you need to contain all this small outbreak. It seems that we did that quite successfully because we only have very, very small scale of interperson infections in Taiwan. And although in the hospital, we have one hospital who had about 13 healthcare workers get minor diseases. And the third stage will be mitigate of the risk. Then the fourth stage, the worst scenario will be evacuate. Luckily, we have not gone to the third stage, the mitigate stage. And later I will explain to you JCT's role in this part of the anti-pandemic strategy. Next, please. Next slide, please. Okay, so the challenges, I would say thank you to the commanding center of Taiwan, because as you look into the history of this past few months, we really face waves of challenges. The first waves of the challenge come from the returning Taiwanese people from China because of the Lunar New Year. So during the Lunar New Year vacation, 400 million Taiwanese people came back from China. So when you look at the chart here, okay, 400 million people come back to Taiwan and they went to see doctors, they maintain their health. About half of them ever visited a clinic or hospital for health check or to see their minor problem. So that was the first wave. It's a massive challenge of the government. We were so nervous because they need to come back for vacation, because it's very important for the Chinese people, to get reunion during the Chinese New Year. That's the most important holiday in the year. So luckily, we get only less than 100 imported cases during this wave. And the second wave is the Wuhan evacuation plans. Because when Wuhan was locked down, there were many Taiwanese people locked down there. The short-term traveler, tourists, and students, and women and women and children, they need to come back. And some people, they are very sick. Some senior people, they don't have enough medicine with them. They plan to come back to Taiwan within a very short period of time, but the city was locked down, so they couldn't come back. But that's a very lengthy negotiation between Taiwan and China's government, because they took a long time to reach agreement about how to arrange the evacuation plan. Finally, we had 4 charter planes coming back from Wuhan directly. And although we have 2 cruises, one is Aquarius and the other one is the Diamond Prince. The Diamond Prince was locked down in Japan for more than 1 month, as you know. But fewer people know that Diamond Prince stay in Taiwan for 24 hours before they sail to Japan. So about 1,300 tourists, they came off the cruise and visited Taiwan for 24 hours. So it was a major event. So when you look into the map here, so there's a small dot. The small dots are the places all these Diamond Prince tourists ever visit northern of Taiwan. So first in Taiwan's history, the Taiwan's government issue a national warning message through the mobile phone. So all of a sudden, when you stay in the conference room, everybody's mobile phone start to ring alarm. They alarmed you that you have stated stay away from the places the traveler ever stayed in Taiwan. Taiwan designed this system. It's a very smart system. We learned from Japan. But the system was originally designed to cope with volcano eruptions, tsunami, and the major earthquake, not for pandemic. But it was the first time that the government used this national warning system through the mobile phone. And the fourth wave is that after the Chinese New Year, the pandemic seems to ease a little bit. So some people, they have already paid for their touring fee, So many people start to travel to Europe, to Egypt, to Turkey. So many touring group came back to Taiwan and brought back the virus. Unfortunately, some very senior people die during these travel groups. And the fifth wave are the returning overseas students. That happened in the first week of March, when the Europe and the United States school, they declared the shutdown of the school. So many overseas Taiwanese students, they had to come back home. So there were about 70,000 students coming back from Europe and from United States, including my daughter. My daughter studied in the United States. She studied in Cleveland, the medical school in Cleveland. So when she left Cleveland, there was no case, 0 case at that time. At that weekend, the first semester just finished. So that was the first week of March. Then when she come back, the case start to occur. Right now in Ohio, there are already more than 15,000 cases and nearly 1,000 deaths in Ohio. Next slide, please. Okay, so what are the key steps for initial success? So I want to use the word initial because I think we cannot celebrate too early, because right now Taiwan has already pushed the anti-pandemic to the extremes. Actually, we don't have any domestic cases, but the world is not safe. We cannot lock down the border forever. So I would say this is only the first phase of the pandemic. First of all, in Taiwan, the professionals are in charge for all this anti-pandemic campaign. So when you see these slides, you can see this one is our Minister of Health, Dr. Chen Shizhong. Right now, he is the most popular people in Taiwan. And next to him is the Dean of Taiwan's National Taiwan University Medical School. He is an infection specialist. And in the panel, the minister, he has an advisory group. So sitting in the advisory group, there are many SARS veterans. So they gave him very precious advices, including our national vice president, Dr. Chen Jianren. During the SARS, he was the Minister of Health at that time. So they gave him very good advices. And the government, president, and also the head of the executive yuan gave him full authority, fully authorized him to handle the whole situation. And we did a very quick border control, as I mentioned previously. And although we know the mask will become a problem, they will cause a panic buying of the mask. So government need to control the supply of the mask. So they imposed the rule to restrict the export of the mask, and also put a severe punishment for who raise up the price of the mask, and to increase the mass production of the mask. And not only to increase the production, but they built the new production line. So right now, Taiwan's mass production already exceeds the needs. So right now we have the luxury to export the mask to help our friends overseas. And the fourth point is the use of the IT technology. So everybody look at the card. This is my national insurance card. Taiwan has a national health insurance. So use this card when the KARS, the information connect with immigration information. You insert the card to the place you see doctor, or you go to the pharmacy. So we will know that whether you have the travel history from overseas and from where. So this is, I think, is the most critical, very important steps to control the spread of the infection. So with the people just coming back from overseas or from infected area, we become very cautious, and the physician will make decision whether to give the test to the patients. Because as I mentioned, we have not done the whole population screen, because the commanding center, they are against the idea till now, because many people suggest them probably we need to do the whole population test for the virus, but they are very careful, still do tests for selected case. There are many issues. One point is that the capacity of the test. So in Taiwan, we can only do around 4,000 PCR tests a day. The other one is that we are afraid if we do the whole population screen, people may not want to keep the rule of the social distancing. If they are test negative, they will feel, why should I take the social distancing because I am negative? Actually, Taiwan is very careful. They need to confirm the case with 3 negative, so they will discharge the patient from hospital. Then the fourth one is information transparency. So it is very important. As I mentioned to you, government put a very strong hand to control all the fake news. And also every day, minister has not have any vacation for almost 3 months, because every day 2 p.m. He will hold a press conference himself to report to the people what happened today, how many cases we have. So every day, everybody look into the press conference very, very carefully, because we need to get the trusted information from government. And the government, the commanding center, gave us very trusted, very important, transparent information. So that calmed down everybody in Taiwan. So there is a joke, say, when you see somebody sit beside minister, you know what happened. So if you see Dr. Chang, Professor Chang here, you know you have new cases, okay? Because he is a clinician, he is a physician. So information transparency, I think, is a very, very important, very, very critical during this pandemic. The screening strategy I have mentioned to you. So we don't do the nationwide screen. So we cannot criticize or comment on other countries' strategy, because the situation are very, very different. So if you have a massive outbreak that like in Korea, so in Dachau, it's already had a massive outbreak, so you have to screen everybody. But in Taiwan, we are not in that state. So we have the luxury to carefully choose the cases to do the test. And you see the line at the beginning. Right now, you don't see this line anymore, because right now we have enough mask supply. But at the beginning, people were panicked, so they stand in the line to purchase the mask. Okay, next. How about the society? So the quarantine is strictly enforced. The local community leader will check where you are. If you are quarantined, you are doing the self-health management. If you leave your home, you will face very heavy fine. They put a very heavy punishment on somebody who not follow the quarantine rule. And we have many social gathering restriction. For example, right now government does not allow for the gathering of more than 100 people. So right now in JCT, Joint Commission, we have many activities. We open up the telemedicine options, and government set up the hotlines 1922. So if you have any question, you have any suspicion, you can call this hotline. Somebody will help you, or somebody will get your information and transmit to the commanding center. So people use this hotline to help each other. And the school, we open up the virtual classrooms, and we are asked to wash our hands, put the mask on at the public places. Next slide. And how about hospital and departments? So all the hospitals right now are on the reduced load mode. So that means that we reduce our service. For example, so right now I have been on N95 mask for almost 3 months. It's very tough. So I cannot see too many patients because when I have the gear on, I cannot go to PP, I cannot drink, I cannot eat. So you have to reduce your service volume, and you have to cancel all the elective surgeries, and no visitor for the hospital. And the TOCC, the hospital, will check the temperature for everybody entering the hospital. And although they check the national health insurance card, so they know where you are coming. And although the system will automatically make the records. So if something happened, the in-hospital outbreak, the hospital and the government can trace the contact of these patients. And we need to streamline our workflow to separate our work teams and the resource allocation and distribution are controlled by the government. CDC has already purchased a sufficient mask and the PPE. So the hospital, they don't have to worry about the PPE because they purchase the PPE directly from government. We enforce the environmental sanitization, and we modify our SOP constantly. These few months, I read the paper quite diligently because the situation is very dynamic. Even though the SOP is standards, but your environment and your procedures may change over time. So you need to adjust your SOP according to the situation change. Next. How about otolaryngology? I'm an otolaryngologist. So this time, is quite different from last time, from SARS, because I think the fever check, at the entry of the hospital may not be very useful because 1/3 of the patient has no fever. But instead, the smell disturbance is a very good indicator. According to Professor Zhang, he presents, in Taiwan's case, 17% of our cases has symptoms of a smell disturbance. And the symptoms are very generic, and may last for more than 14 days. So that's a big problem. That's why many people guess that the pandemic will not finish very quickly, because it's not like SARS. It's very easy to identify the high fever cases. Many people, maybe as many as 50%, has no specific symptoms. It's more generic, like a normal flu. And in the primary care place, we are in lake of PPE, and primary care ENT are in crisis. But right now, government's policy is to put all the cases, because right now we don't have a community problem. So we still have the luxury to concentrate all the cases into the hospital. We have different layers of defense. So right now, the primary care, we still not giving them a very heavy duty to do the community screen. Next. Next, please. Okay, so how about Joint Commission of Taiwan during this pandemic? So this year's hospital accreditation has been postponed early in February. So our minister gave the order, very early in the pandemic, says, okay, we will stop all the hospital accreditation, because right now all the hospitals are very, very busy to prepare themselves for the pandemic. And although in JCT, we impose the I am safe activity. So that means I check all the health status of the JCT employees. So everybody, if they have any health problem, I want to know at the first place. And we also do the workload and office control. And we open up all the teleconference options for all our activities, because many of our experts are from hospital. So we've been very, very careful to protect our office environment. And the Operation NOAA, okay, so this is a mission government gives to JCT. So we want to check the hospital readiness for massive community outbreak. So they give this a term called a forward deployment. So we want to check if hospital, they are ready, if there are many massive community outbreak. So if their negative pressure rooms are ready, or their isolated ward are ready. And although government created a very huge scale of the healthcare workers compensation package, a few days ago, I had a grand round teleconference with my United States friends. So they asked me if the hospital in Taiwan has a plan for layoff, because our hospital revenue although drops more than 40%. I say no. To the contrary, as I mentioned to you, we know that we need to reserve the manpower in case of the massive community outbreak. So we don't have any plan for layoff. Instead, we give extra money to the doctor, nurses, technician, even the janitor, extra money if they take care of the COVID patients, or they take care of the ward. And although the National Health Insurance provides a huge hospital relief fund, because they need to help the hospital from bankrupt. So they need to keep the cash flow for the hospital. So right now, no ask, the National Health Insurance will give the hospital 60 to 80% of the reimbursement they get from 2019. So they will give the hospital this money in advance, so they can pay back, when the pandemic is over. So that's the financial mobilizations of the government to help the Taiwan's hospital, because we need to secure the hospital. We need to protect the hospital employees. So that's a lesson we learned from SARS. So at this point, government responds very, very quickly. And although we just about to finish another project, is to estimate the reserve of the ventilator. So we did a nationwide inspections of the hospital to see if they have any ventilator left for use in case we have massive outbreak. So we need to purchase all this ventilator from government. Government will pay to buy all this ventilator to serve the hospital who need them. So we just about to finish this project this week, and we estimate the number, and we evaluate the situation of the ventilators, see if they can be repaired, and to see if they have any parts that need to replace, and we can put several disabled ventilator together into one functioning ventilator. So that's what government is preparing right now. And although the president of JCT, so he wrote a letter to all the PGYs, because JCT in Taiwan, we are in charge of the postgraduate training in Taiwan. So we are, all the medical students, they are interns, though they are kept away from the clinical area. But the PGYs and although the resident, they work with us. So we think this is a historical moment. All the young physicians, they need to learn from this pandemic. They need to learn and prepare themselves to leading against next pandemic. So this is an extraordinary historical moment. They need to work with us. And as a CEO of the JCT, because many activity been canceled, many projects been delayed, so as a CEO, I was under a very great pressure to watch all the money issues of my organization. Next. Okay, how about the research and innovation? Taiwan has been very strong in research and innovation. So during this pandemic, you will see a lot of research going on with the vaccine. As I know, there are as many as 4 to 6 teams developing the vaccine. And although we participate in the Remdesivir international clinical trial, and also the hydroquinone, as I know that Taiwan's case, because we only have more than 400 cases, so every case are taken care very carefully. So we did a lot of research. I believe we will have very solid data to publish in the future. Then the screen, many companies are developing the screen kit. And there are some infection control invention. So right now we have the outdoor screen posts, and they can do the screen from the house. So the healthcare worker need not to go out of the building. They can do the tests for patients. And Taiwan is right now is getting very hot, especially south and middle of Taiwan. So when you have all the PPE on, it's really very difficult for the healthcare workers. So this design help them. They can do the work easily and safely in hospital. And although somebody designs hood to cover the patient so they can do the intubation safely. And also the development of the telemedicine. Before, Taiwan's government has been very, very conservative to develop the telemedicine because Taiwan's medical resources are very intensive, so they don't feel the need. Only in small islands and the high mountain, people cannot access to the health care. So they are not very zealous about telemedicine. But this time, they feel telemedicine is very, very important because if the minor cases, they can check the TPR for themselves. So that can save very much time for the nurses and also can save the PPEs because they estimate when taking care of one COVID-19 case, it will consume 200 PPEs. And although some IT companies, they develop different solution of the to check our national health insurance card. So can you show the video here? Can you show the video here? Yes. So only 1 minute. Okay, so they designed this screen machine, so you don't need even to touch the screen. You don't do the keyboard. You know, they can read the information of the card, so they know where you come from. And we are the healthcare workers, so you know, so we've been marked, so so they know you are a healthcare worker. Or some pilots or airline workers, you know. They know their job, you know, so they will take special caution for this these visitors to the hospital. Next, please. And how about geopolitics? You know, because Japan is quite unexpected because of the Olympic Games. You know, so Japan was very late to start its anti-pandemic campaign. So they miss out the golden time. So they have many cases. But right now, this week, it seems that Japan is doing quite okay. And Korea has a local massive outbreak. But right now, they control the city's outbreak from spreading out quite well. In Hong Kong, like Taiwan, they were heavily beat by the SARS. So they learned a lot. Right now, they are doing very well. But, you know, they are very dangerous because they have a border close to China, and many of their workers coming from China. So there's a dilemma whether to open up the border and let the worker come back to Hong Kong to work. And the Vietnam, you know, is doing very well because they locked down, closed the border very quickly. So right now they have only less than 300 cases. And Macau is very small and doing very well. The Vietnam, even though they do very well, but you know, the major hospital, major university hospital back May, the hospital crashed. They had to close for 2 weeks because their meal contractor brought the virus back in hospital. Right now, they are reopen again. And Singapore, at the beginning, you know, Singapore doing very organized, but you know, the policy is to let the infected minor cases to stay home. But right now, they have so many cases, you know. So history will tell us whether their strategy is correct to let the minor case to stay home. because I look into the population and the number of Singapore, I really worry about Singapore right now. And China, right now, they do a very strict quarantine, the big area and a small area. And although China start their so-called big international propaganda, and the military show up, it's very strange because it seems that they want to transfer the attention from the internal, and all the information are not transparent. So it makes other countries very difficult to make decision whether to open up the border to China. Taiwan usually has more than 300 flights from Taipei to different cities in China. Right now, we close to about five major airports. So our government is facing the very difficult decision whether to open up the airport to fly to China. Next, please. And the future challenges. The latest challenge come from the combat ship. The ship, very interestingly, they sailed to Solomon Island and Palau for rehearsal and exercise. And unfortunately, 20-something of the sailors got infected with coronavirus. And when they come back, they've been quarantined for 3 or 6 days at the port, then let all the sailors go home. So they were very happy, and everybody go back to different cities in Taiwan to see their relatives and families and girlfriend, you know. But 20 cases got positive. But luckily, this already finished last week. So we only got 4 additional cases because the ship has stayed in Pacific for more than 40 days. So probably the virus load is already very low. And people continue to debate about the screening policy and the capacity. Many argue that the government should do the whole population screening. Right now, we have already had 8 days with no case. So right now, the government is facing tremendous pressure to open up the economy and to release the social distancing rules. So, so it's a big dilemma. So I think they probably have a schedule, but we don't know how will they do in the near future. And we worry about the herd immunity problem because we don't have cases, you know. So that's a problem because 1 year from now, everybody in the world has immunity, but we don't. So how do we expect the vaccine to come into the market very quickly and in time? So that's a big issue of Taiwan. Next. Next, please. Okay, so right now, people propose a term called the new normal life. So right now, we live on the new normal life. That means you feel you are okay right now, but you know, something will happen. Then you will need to come back to the quarantine or to the restriction. So they call this a new normal. It is not likely the virus will disappear in a very short period of time. So we have to admit that we will live on this new normal life for a while until the vaccine come to the market. So this is my conclusion. We are not safe until the world is safe. So all the people need to work together against the coronavirus. Thank you. That's my presentation. Thank you. Thank you.
Thank you, Professor Pa. Very, very nice presentations. And next, maybe Dr. Panduryono will give some comments. Dr. Panduryono.
Yes, thank you. Congratulations for Professor Pa that Taiwan has already given the example how to dealing with this pandemic in very promptly and the early beginning. That I heard that also the Taiwan informed the WHO that about this possible pandemic but WHO also denied in the first time when Taiwan's give warnings to WHO. And I heard that Taiwan also got invited to come to the joint meeting in WHO, even Taiwan is not yet has become a member. This is a good sign that Taiwan will be involved to helping the assistance to all the world, to people in the world, how dealing with the pandemic. And I agree that we can learn from this his presentation that the preparedness is very important, and the prompt response is very important. And we have a problem because in Indonesia, in January, even in January, February, we already observe the people who have the COVID symptom, and since the problem in our country is the testing, until now we still have problem with the testing capacity. Cannot confirm that COVID symptom as the patient not yet as confirmed laboratory. And after March, in the first month, and we find the new cases. But even the director of WHO is not already warning to the presidents to give some place Indonesia start earlier to prevent the epidemic, but because political situation and Indonesia is very difficult to have the right decision in politics to give this priority to public health and have conflict with the priority of economy. This is how we can dealing with if we making the social distancing approach or quarantine approach with the problem is economy will be going down. But whatever that we will have it is the economic is always going down, and now we have current increasing. Still, we have current increasing the cases in Indonesia, but we have still problem in testing capacity. Our testing capacity is very low, and we have delay for the testing for people already admission to hospital and got taking care for the COVID, but waiting for 3 and 5 days, and sometimes is until 1 week because the flowing of the patient who suspect COVID suspect itself. It means that this is very unfortunate for Indonesia, because also if the governments already start earlier and give warning to the not to the people, but especially for the community, for the hospital, and we got a lot of problem, and the doctor, many doctor and nurse got the COVID and die because when they treat the patients, they don't know the patient is most of the patient is asymptomatic.
Yes.
They come to the hospital and the symptom is unspecific for COVID, but finally it's COVID. It means that we lost many bright doctor in Indonesia. This is another problem, that because we not give warning to all doctor and all hospital. It means that also a problem for the protections. It means the protection equipment for the doctor is very limited because we not prepare, and currently we have still problem for that. It means that because the situation like this, and also we got even the cases already increasing, and in some area already put the social distancing approach, but we will have another problem because this month is Ramadan month. People like in Lunar New Year in China or in Taiwan go to the family, and this is problem because we call it the mudik problem, because people will exodus to go to the family, to their hometowns, and also when people returning to the big city, also we will have another problem to dealing with the increasing of new infections. We still not yet cannot control this pandemic because the situation is like this. But even like that, is the political or British people is doesn't care, and they want openly they want to remove the restriction, and the business will be back, because without this the economic will be die. They said that there are a lot of suffer people, and many people will be fired because of this situation, economic situation. We don't know when we will open the restriction, because currently we're still increasing the pandemic, not yet reached the peak, and we expected the peak is during Idul the Muslim celebration for after fasting months. And then also the problem at the time is many people celebrations of the Muslim festival, but also many people will also got infected, and maybe after that some people will die, because in rural area or in the small towns, the hospital is unprepared for taking care of this patient. This is the problem in Indonesia, Professor Pa. And I would like to ask you, because I learned from your country dealing with the TB, because I am involved in the TB program in this country, and we want to end TB epidemic by 2030, because I learned from your system is very good. You are prepared well, and everything is under one system and connected each other. I also envy with your leadership even in your vice president is epidemiologist, and also your ministry is very good in leadership, and many doctor involved, the clinical doctor and also public health doctor working together. And if you can assist us how dealing with the disease testing capacity is very good, because we got a lot of problem with the testing for diagnostic or screening for the people with who is in high risk, especially when we reopening some business activity. And I'm also epidemiologist, trying to put some criteria, epidemiological criteria, healthcare criteria, and also some criteria from public health should be fulfilled before we move to removing some restriction in some step. And this is very difficult. That's my comment, that I am very happy to hear your presentation, because we can learn the preparedness and the control. I mean, the always working and in very good system is the way we can win with the virus. And this pandemic may be not yet finished until this year or next year, maybe another 3 years, 4 years, that we will have still problem, because even we have some vaccine, we have problem also when we deliver the vaccine to the people. It might be very difficult to Indonesia is a big country and so many islands to reach the high coverage of the vaccination is also have difficulty. Thank you, Professor Pa. This is my comment. Congratulations. I should learn from you very much, and and I want to talk to you next time.
Thank you. Thank you. Thank you.
Dr. Hani, I already give some.
Yes, Professor Pa. Yes, you hear? Yeah, that's Dr. Pandu Riono. He's epidemiologist, one of the best epidemiologists in Indonesia, teaching in public health university and Indonesian university. Maybe you have some answer.
I did not hear his question. So can he repeat again?
About TB.
Professor Pa, learn from your experience and about the testing capacity and also dealing the hospital capacity, because when we reopening, I put some criteria that testing should be increasing. The testing capacity, PCR testing capacity should be increasing, and contact tracing should be increasing, and also hospital should be prepared. Even primary health care, the hospital, public hospital, and also private hospital should be ready, and the ICU should be ready, and when before reopening, because we afraid of the second wave of pandemic, and we hope there's will not happen. But this happen, we should prepare. Can you have some suggestion to our colleagues in here, because they are working in the hospital?
Yeah. So what's the question?
Dipendekin mungkin, Dok. Shorten the question. Pak Pandu.
Yes.
Maybe I can help. We are going to open the isolation, the quarantine program, but we are afraid that for the second wave, and whether the hospitals are ready for another surge of patients, something like that.
Yeah. So
that's the problem in Indonesia.
Yes. So you have to watch the outside environment. So it really depends upon the how's the situation of the community. What's the location, your hospital, how dangerous it is. So the most likely scenario is that patient coming to the hospital for some other issue, for emergency surgery, for delivery, you don't know what they bring, because so many patients, they are asymptomatic, So when they come into the hospital, suddenly you find this corona case. So how do you do? So you need to simulate, and you need to rehearse this kind of a situation. So when you admit the patients, not for coronavirus infection, but when they admit, it turned out to be a corona infection. So how do you evacuate the whole world? How do you evacuate and protect the healthcare worker? So that's the issue you need to think about. So that's what I said. You need to separate, segregate your service, to separate all the service, and to streamline your workflow. So you don't let the visitors, don't let the patient to overlap with each other. So you can contain the spread of the infection in case it's happened. So it's really very likely that will happen in the hospital. So you need to be very, very careful. So I mentioned before, because this time we have a big hospital who has a small scale of in-hospital infection. So the two patients admitted in the same ward, but they live quite separately. But how come the nurses and the physician got infected? Because they guess the worker, the janitor, who washed the rooms, they brought the virus from this place to that place. So in this case, you need to really think about the process the care process of the hospital. So this order must go down, not only the hospital-wise, but also to every ward, also to every specialty, every department. They need to think about their own care process, and they need to rehearse the cases, as they need to screen their patients. This time moment, they need to prioritize their service. So that's why many hospitals have already closed the elective surgery, elective procedure. And for like my profession, I'm an ENT, so we don't do any spray anymore. So we reduce all the local treatment, and we've been very, very cautious when we do the endoscope examination. So that this kind of things, we'll need to go down to every department. We'll need to go down to every specialist. They need to think about their own patients, because everybody, every department, they have their own problem. They need to think. They need to redesign their care process, right?
Dr. Pandu, do you have still questions?
Yeah,
No.
I forgot I didn't hear the first part, that maybe about the testing capacity, because you can explain that.
Yes. Okay. So about the testing capacity. So like in United States, I just read an article. Okay, right now Taiwan still do the centralized testing. So that means they will send the sample to CDC. But right now, government gradually authorize the peripheral, the hospital lab, to do the test by themselves. But their test accuracy must be validated by the government. So by doing this, they can increase the capacity of the test, because actually many hospitals, they have this kind of a capability to do the test by themselves. They can convert their research capacity into the clinical service. Before, they only do the research, but right now they can start to do that. So I think the United States, they are doing the same way, because in university labs, many of the labs, they already stop or close their regular research job and convert their facility to clinical service. So you can do that. You can think about this, and also the criterion-based screening. So as I mentioned to you, that's a constant debate between the public, some scholars, some experts, and they keep advising government, why don't you do the whole population screen? But our commanding center, they still decided not to do that, because it seems that the whole time period is quite long, So during this time period, any time period when you test negative, that doesn't mean anything, You can become positive anytime. So you really need to reserve your capacity. You don't do the screen so easily, because when you read all the news and the media, in some country, the false positive, false negative rate is very, very high. So you are wasting your resources to do a futile work. So our government, they insist to do the criterion-based the test for the suspected cases, right?
Yes. Thank you,
Okay,
Professor.
Thank you.
Thank you. We have some questions from the floor, but before, maybe Professor Kadar from MSUS. Please, your floor, Professor Kadar.
Thank you, Dr. Hani. Assalamualaikum dan good afternoon to everyone.
Hi.
Hi, Dr. Pat.
Hi, how are you?
Very fine. That was an excellent presentation, very informative. I think you have shared quite a number of secrets that you have been doing. So I think there's a lot of lessons that we can actually learn. And one of the things that actually strike me most is your early start in controlling, in going the process of prevention. I think that actually has come up very well, and you can actually see your outcome currently as you have 0 cases for the past 8 days, and that's excellent. We are still struggling. We in Malaysia here, we are actually having the lockdown is still extended until 9th of June. However, we have got partial lockdown in certain areas. So, and furthermore, with the coming of the Aidil Fitri, the Hari Raya festive season, I think the government is strengthening border control. So even within states, within Malaysia, we are actually controlling the people. We are not encouraging people to go home. No more balik kampung this Hari Raya. So everybody stay put within your state, and you have to go along with this Hari Raya, not the usual Hari Raya, but you can still contact your families through Skype or telephone conferences and all that sort of technologies that is currently available. So I think what you have shared with us is interesting, and I think there's a lot of strategies that we can actually learn from you. And thank you very much for that excellent presentation and excellent strategies that you put in. Thank you very much.
Thank you, thank you, thank you.
Thank you, Professor Kader. Yeah, Professor Pa, we have the same problem. If you can control your Chinese New Year, but we have now the Muslim big way. Over about 9 days again, a lot of people wants to go home, and the police are blocking the streets, and everybody is angry. That's trouble.
Yes.
Maybe from the floor. Do you need some questions, some answers, Prof. Kader? No. Indra, please put the questions. This is the questions. Yeah, this is the questions. A local quarantine, regional lockdown might be able to stop the spreading of COVID-19. However, how to deal with its impact? The absence of
pressure,
supplies, the lack of access of daily basic needs, and physiological pressure.
Okay, so I think
you don't have lockdown in Taiwan, yeah?
No, we don't have. But you know, as I know, many of my friends that work overseas in other countries, they take the strategy called the soft lockdown. So they are allowed to go out to buy something from the supermarket. They are allowed to go to the pharmacy to buy the medicine. So, or they are allowed to go out, you know, once or twice a week, you know, to purchase do the grocery shopping. So the control of the goods, you know, I think that depends on the government's logistic management. But I think it's very interesting. I can share with you. It's a very interesting, you know, because one day, 1 or 2 days, you know, in Taiwan in the past few months, we have several days that single day we have 2-digit number. So that caused the panic of the public, you know. So people rush to the supermarket to do the grocery shopping, including me, you know, because my parents, they are very low. They stay alone in my hometown. So when I looked at the number, one single day we have 30 or 40 something, you know, I feel that something is going to happen, you know. So I rushed to the supermarket, do a 1 month supply for them. Okay. But you know, our executive Yan, our prime minister, so he immediately made an announcement in the television, say, okay, you know, I encourage you to buy more things, you know, because that will help the economy. So he did a kind of negative announcement, the advertisement, did it from a different way, you know. So encourage people. If you do the panic buying, you know, please buy, you know, so that will help the economy. But actually, you know, in the market, we don't have any shortage of the daily supply. So, so the answer will be a soft lockdown. Even United States, in many states, is under very stringent situation. but people are still allowed to do the grocery shopping, to buy something they need. And the physiological pressure, I think, is very big because okay, so as an otologist, because I see many inner ear patients, many disease. So these days, I see many patients come to me because pressure is a predisposing factor to the vertigo attack. So people, they are locked down in the home, they're getting crazy, and there's so many business crash, and people, lost their job. So the government really need to think about this way, So I think the economy relief, the reopen plan is very important. So I would not say Taiwan has been very successful in this way. So we might be quite successful to prevent the spread of the disease. But from the economy side, I heard a lot of complaint, because it seems that we don't have a very clear plan of reopen, because all the reopen schedule been delayed and delayed and delayed. And I think it's very difficult for government to make any definite decision, because the whole situation are controlled by the outside world. So physiological and psychological pressure are very important. Many years ago, after the SARS outbreak, I wrote a paper. This still can be searched on the PubMed, because we search all the people with a SF-36 questionnaire. Really, people are under great pressure under this situation. Not only the healthcare worker, but the general public. So there are many pressure, and this pandemic will change our lifestyle, probably for good. Thank you.
Thank you, Professor Pa. Dear listeners, because due of the time limits, we cannot answer all the 6 questions. So we go to the last closing speech from Dr. Sutoto. Please, Dr. Sutoto.
Thank you, Dr. Hani. At last, we come to the end. I, Sutoto, Chief Executive Officer of KARS, would like to congratulate my best friend, Professor Pa Chung Wan.
Thank you.
As a Chief Executive Officer of Joint Commission of Taiwan, for your excellent presentation, your heartly kindness to share, and your country knowledge on how to control COVID-19. That your country Taiwan has done superbly all the word knowledge that. I also thank to Dr. Panduriano, also Dr. Kadar Marikar. And I do hope that all of you, also webinar listener, enjoy this and get a lot to learn from it. And stay tuned always to KARS webinars. Together we'll make all the Indonesian hospital as a world-class hospital. Goodbye and Assalamualaikum warahmatullahi wabarakatuh. Thank you very much, Professor Pa.
Thank you.
Thank you, everybody.
Thank you, Dr. Kadar. Thank you, Dr. Pandu.
Thank you, Dr. Hani.
Yeah.
Thank you, Prof.
Thank you.
Okay.
Selamat berbuka puasa.
Wow, thank you.